So welcome to class today. Today we're going to be playing a card game called Who Are You Going to Call? And what it's going to be is it's going to be 4 different immunity case studies. You guessed it, spade, heart, club, and diamond. And you're going to decide each one of these patients is going to need the nurse to call someone and to intervene somehow. And you need to figure out as the nurse who you're going to go call, who you're going to call, and then who you're going to call first. So which of these patients is going to end up taking up your priority? So let's get started. So here's the rules of the game. You will need 4 cards or pieces of paper with each suit drawn on it. So make sure you pause the video and get those ready for you. So you'll want a card that has a heart on it, a spade, a club, and a diamond. Because you'll be given 4 patients, each with those characteristics, I guess, or names. So, and as we go, you're going to put information, or as we get more information, you're going to be putting those patients in order. So each round we will add more data to each patient, and between each round we'll have questions to help you reflect on the care, on the prioritization, maybe the medications, the connections of labs, that kind of stuff, and helping you figure out what information is really important. Because that's another thing that we have to realize as a nurse. We are given lots and lots of information and data as nurses or anyone in the healthcare profession. Not all information is important. Some information is more important than others. So that's why we really need to make sure we're able to prioritize our information so that we can better care and prioritize our patients. Feel free to do this with a classmate or a friend, because after all, nursing is a team sport and games are better with friends. So we're going to start with our 4 patients, and I'm going to give you reports. So hopefully you've got your notes and you're ready to start. So we're going to start with Donald Diamond. He has ALS. So he is in rehab. So I forgot to tell you guys, you are in a rehab facility. So he's in rehab, and this is his 3rd round of aspiration pneumonia. He has a trach to maintain his airway, a PEG tube for feeding. So he's not on a ventilator at this time and is still struggling with some aspiration pneumonia and that kind of stuff. We have Heather Hart. She got a kidney. So she is a kidney transplant patient. She received this kidney after she went into acute renal failure, after she had a knee scope done where they gave her contrast, and the contrast did a lot of damage to her kidneys, making her kidneys no longer function. So that's something we also really have to pay attention to as nurses. If we're prepping somebody for anything that's going to use contrast, we need to make sure that they have well-functioning kidneys, because that is how it's filtered out. So she's about 30 days out from her transplant, and she is now in rehab to rebuild her strength and to get better. We have Connor Clubb. He has a history of Crohn's disease. So he is here for a bowel resection that he's had several of them. So he's on multiple rehabs from those, but then they also did a revision of his colostomy. So he had a colostomy before, but now we've done a revision of the colostomy and trying to make it function better, or just because of scar tissue. I don't know. I didn't read the doctor's note, so I'm not exactly sure why they had to do a revision, but they did. And so that's good for us to know. And then we have Sally Spade, and she has multiple sclerosis, or MS, and she is here because she had a flare-up of her MS, and she is now rebuilding her strength back up. She's also here to finish up some IV steroid use to help calm down the inflammatory process and to bring down the immune process that happened with the flare-up. And then, just so you know, like normally she walks with arm canes. So normally she's got pretty strong arms and legs, but still just some weakness and needs a little bit more stability. So here's your 4 patients. I want you to spend a few seconds looking at your cards and putting them in order of who do you think is going to be your first person you have to make a phone call on? Is it Donald Diamond with ALS? Is it Heather Hart with her kidney transplant, Connor Clubb with Crohn's, or Sally Spade with her MS? Okay, now that you have them in order, let's go ahead and get some more data on these patients. So first, we have to pick a card. So we got the 6 of hearts. So that means we're going to get 6 pieces of data added to our patients. All right, so let's see what we get. Looks like we're going to go with some vital signs. So Donald Diamond has a temperature of 99.1 Fahrenheit, a blood pressure of 122/65, a heart rate of 65, 80, and he is 89% on 30% trach mask, and his respiratory rate is 24. So he's got a little bit of respiratory issue going on there. Then we have Heather Hertz. She's got 99.8. Her blood pressure is 178/95. Heart rate is 110. She's 98% on room air, and she's breathing at 18 breaths a minute. Connor Clubb, he's got a temp of 97.8 Fahrenheit, blood pressure of 132/88, heart rate of 56, respirators of 16, and then satting at 97% on room air. And Sally Spade, 97.1 Fahrenheit for her temp, blood pressure is 92/45, heart rate of 86, saturation of 99% on room air, and a respiratory rate of 14. Well, we said we got 6 pieces of data. This is only 4, so we've got to keep going. Oh, it looks like we're going to get some medications. So Connor Clubb, he gets Remicade infusion. Q3 weeks. So every 3 weeks, he's getting an infusion of Remicade. And Donald Diamond, he's getting Zosyn IV via his PICC line for the next 45 days. So that's our 6 pieces of data. So now I want you to take some time and put your patients in order. With this new data, what are you thinking about? Who is the nurse going to call for each of these patients? So looking at who you've got, who are you calling for each one? Who needs to be the call to go out first? And then what is the nurse going to say in that call? So you can see here, I gave you an SBAR format. So you can kind of think about with each one of these patients, go ahead and think about the SBAR format and what you're going to say for each one of them. So who did you pick to go first? Did you pick Donald Diamond with his ALS and his oxygen saturation of 89%? Or did you pick Heather Hart with her blood pressure of 178/95? The other 2 seemed pretty stable as far as their vital signs. Did you know what those medications were? Did you know what Zosyn is? Do you know what Remicade is? If you don't know what those things are, take some time to make sure that you're looking them up. It's important that you understand the medications that patients are given, and then what all goes into those medications. So let's keep going. We need to pick another card because we've only been given 6 pieces of data. So let's see what we draw this time. Oh, well, boogers. It's a 3 of spades. That's not going to give us a whole lot more data to work with, but we'll keep going. All right, so here's our patients. Let's see what data pulls up. Well, since we were doing medications, we'll probably finish off with our medications. We've got Heather Hart, who is the transplant recipient. She is getting Prograf twice a day, so BID. So Prograf is an oral medication. I'd make sure you know what medication that is if you don't already. Sally Spade, she's getting Solu-Medrol Q8 hours via a port. Think about, is a port within your scope to use? And then she's getting a Tysabri infusion every 21 days. And this medication is relatively new, so sometimes the dosing changes based on the research. Well, this is only 2 pieces of data, so we want to make sure we're finishing up, and let's get that one more piece of data. Oh, good, we got some assessment data. This is going to give us a little more meat to pull apart here. So Connor Clubb, his assessment is his stoma is protruding. It's dusky and moist. The peristomal skin is pink and painful. He has lots of drainage of thin liquid stool, hypoactive bowel sounds ×4, soft and tender. He's alert and oriented ×4. He's strong and equal ×4. His lungs are clear throughout. All right, well, only 3 pieces of data doesn't give us a whole lot, but I do want you to go through the same reflection questions. Who is the nurse going to call for each patient? Who needs the call going out first? So are we calling somebody to come help us? Are we calling our charge nurse? Are we calling 911? Are we calling the surgeon? Who are we calling? Are we calling a consult for like speech therapy or for the ostomy nurse? Who are we going to be calling first? And then what are you going to say when you call? It's really important that you make sure that the data that you give, the phone call that you make, the data that you put into it is the pertinent data. Remember, not all data needs to be put in there. And when you're calling doctors and consults, we need to make sure that we're using our data wisely. So I'm going to give you about 10 seconds here or so to kind of think about and put your patients in order. All right, so did your order change of who you're going to, which patient is your priority and which patient you need to call someone first? Who are you calling? Are you calling Donald Diamond's family to have a discussion? Are you calling Connor Clubb for him? Are you calling an ostomy nurse to get a consult in? Or are you calling his surgeon? Are you calling Sally Spade's primary care provider and asking him about that drug dosage? Are you calling Heather Hart's transplant surgeon? Or are any of these patients urgent or non-urgent at this point in time? So come on, guys, we need some luck. Let's pick a better card than 3. Let's see what we get. Oh, thank goodness. We get an 8 of clubs. That means we're going to get 8 pieces of data. So this is really going to help us out with these patients. So we've got our patients here. Let's add some data. So Donald Diamond, he sneaks sips of water even though he is NPO. Family gets it for him. They are kind of naughty. He is wheelchair bound. He does have some gross movement of his extremities. His left lung is clear, but his right lung has crackles. He has 2+ edema, bilateral lower extremities. His muffled heart sounds, and his pulses are weak ×4. So that's not a real stellar assessment. Heather Hart, she's not feeling so good. She has increased weakness and sleepy. She's got lung crackles and diminished throughout. Pulses bounding. She's got 3+ edema in the bilateral lower extremities. She's pale. She's oriented ×4 when awake, but she's often sleepy and not feeling good. So that is not super stellar for her. And then we have Sally Spade. She's got crackles throughout. Pulses are palpable ×4. She's got no edema. She's alert and oriented most of the time. She's got some weakness in the legs, but they're equal. She does have strong arms, and they are equal. She's got 80 mLs of urine in the last 12 hours. She doesn't like to drink because it makes her cough. So thinking about the assessment data that you've gotten, if you would want to at this point in time, I'd almost take a pause and just circle the important data, because not all this data is important to what's going on with your patient. Some of it's more important than others. So think about if you were doing your lovely concept maps, which I know you guys love so much, what would you put on it? What if this information, or even your priority mapping, what if this information becomes a priority over other information? Well, we drew an 8, so we need to get at least 5 more pieces of data here. Oh, it looks like we've got labs hopping in. So we've got, for Donald Diamond, we have a hemoglobin of 13, a hematocrit of 36%, white blood cell count of 15.3, potassium of 3.5, sodium of 136, and then he had a chest x-ray done, which shows infiltrates in the right side. We have Heather Hart's labs. We have a hemoglobin of 8.2, a hematocrit of 18%, a white blood cell count with no result. I wonder if it clotted off or something. We have a potassium of 5.8. We have a sodium of 138, a BUN of 62, and a creatinine of 6. Connor Clubb, we have a hemoglobin of 15, hematocrit of 45%, a white blood cell count of 8, potassium of 3.4, a sodium of 132, a BUN of 8, and a creatinine of 0.9. And our last set of labs for Sally Spade is a hemoglobin of 9.9, a hematocrit of 48%, a white blood cell count of 12, a potassium of 5.1, a sodium of 148, and a BUN of 12, a creatinine of 0.8. So looking at these labs, what is abnormal and what is normal? At this point, you guys should be able to pick out normal and abnormal pretty quickly and be starting to pull some of that information together. What labs are making you concerned? Which labs can you not pay so much attention to? Now, we said we drew a number 8. That means we get at least one more piece of data. Oh, so Connor Clubb, he is 38 years old and he is a full code. So that being said, we're going to go ahead and give our code status for the rest of our patients because that becomes a really important thing as we're giving care. So we've got Heather Hart. She is a full code and she is 48 years old. We have Sally Spade. She's a DNR, DNI. So do not resuscitate, do not intubate, and she is 42 years old. And then we have Donald Diamond, and he is 52 years old, and he is a full code. What if this information is surprising? What if this information is relevant? So, and then why is it relevant? Why do you pick the information you pick? Understanding why we pick things is really important and it helps us understand what's going on with our patients. Things to think about. Is a do not resuscitate mean do not treat? It doesn't. So just because people have a DNR or a DNI doesn't mean that we don't treat them for what is going on. What we need to understand, especially with these patients, is we've got Sally Spade and she's got crackles throughout her lungs. She's not drinking, which then is making low urine output. What interventions for these patients would you want to do before you would call a provider or a consult? Would you want to make sure that, like for Sally Spade, would we want to make sure that we bladder scan her? Because maybe she's retaining urine. Would we want to look at her eyes and nose and make sure how much she's had in and out? Would we want to make sure that her vital signs are matching what she's looking like? Something's going on with her, but is it just part of her MS flare-up? Or is it the fact that she's just that sick? And we have to understand what's going on. Like, is she at the end stage of her disease? Or is it something we just need to give her some care? She definitely has a high potassium. That's a little concerning. Looking at her hematocrit is a little concerning for me, just because when I look at it, it's 48%. What should her hematocrit be? Remember, hematocrit should be 3 times your hemoglobin. So a hemoglobin of 9.9, so roughly 10, her hematocrit should be around 30. It's 48%. That tells me that we've got something going on. Either she's and what it looks like to me is that she is pretty dehydrated. Even though we've got crackles in the lungs, the crackles are probably from more of that fluid is getting down into her lungs because the MS is probably messing with some of her speech and swallow issues. All right. Connor, what are we worried about with him? Did you notice that his peristomal skin was pink and hurt? The color of his stoma was not really what we want it to be. So definitely we've got something going on with him. What about Heather Hart? She's got some stuff going on. We've got a hemoglobin of 8.2. With a kidney patient, is that hemoglobin really an urgent one? Not really. Remember, they don't make erythropoietin. We aren't sure if this kidney is really working or not. What's potentially going on with her? Is that kidney still working? Or is that kidney starting to be rejected from her body? Now we have to think about, these aren't all autoimmune diseases. Heather Hart had a kidney transplant. She's at risk for going into rejections. And so it's really important for us to pay attention to. And then we've got Donald Diamond. Now think about ALS and what it affects. Does it affect the brain? So we talked about MS, and MS can make things affect the brain. But ALS, while it's similar to MS, is different in the fact that it doesn't impact the brain. So people are fully cognizant. It puts them at huge increased risk for depression because they're fully aware. So is he aware that he's taking sips of water even though he is NPO? Absolutely. Is his family probably aware? Yes, they are. But so then that goes to, what kind of conversations do we need to start having with this family? What kind of conversations do we need to have with him? He's still cognizant, he's still aware, he's still able to make choices. So maybe we need to have some conversations with him. I look at that white count's a little high. That's kind of saying to me that we've got some sort of infection or inflammatory process going on. So you've been given all this data, and we've kind of gone through each disease process in each patient, but who do we need to call? Who do we need to call and get care for that patient? What order are you going to put that patient into? And what are you going to say to the person that you're calling? So did you figure it out? Another thing to think about is urgent or non-urgent. Who of your patients is an urgent need to deal with now versus who is the patient that is a non-urgent patient and we don't really need to necessarily deal with them right now, but it's something we need to deal with definitely in our shift. Thinking about that, what will help us understand this is thinking about, what is our goal? What is your goal for each one of these patients? What is your goal of care, and what is your goal for your shift, and what is your goal for the day? So thinking about that, we've got Donald Diamond. He's our ALS patient. There's a lot going on with him, but what are we going to want to do for him? What's his goal? Write down your goal next to him and think about, how am I tweaking this for him? Heather Hart, what is your goal for her? Is it that we need to deal with a certain piece of the data? Do we need to deal with her hemoglobin of 8.2? Or do we need to deal with the fact that she's sleepy and not feeling real good? What is our goal of care? Do we need to deal with her blood pressure of 178/95? So looking at her information, how are we going to take care of her? What is our goal of care? Connor Clubb, what do we have to do for him? What is our goal of care? Are we worried about that stoma that's protruding, or that the peristomal skin is pink and he complains of pain with it? What are we worried about with him? I mean, we know he has Crohn's, so we know he's had lots and lots of bowel resections. And we know that eventually he had then received a colostomy for it. So he's pretty far down that train if he's gotten to that point. What's our goal for him? And then Sally Spade, what's our goal for her? What information from her assessment or what information from the data you collected helps you figure out what her goal is? Is her goal to continue the steroids, and so to maintain her MS until the flare-up has decreased? Is our goal to encourage her fluids so that she's well hydrated, so that she can flush out some of the irritations from all the antibodies that are built up? And then which one of these patients is your first patient you're going to see, or first patient you're going to make a call for? Is it Donald Diamond? Is it Heather Hart? Is it Connor Club? Or is it Sally Spade? Who is your first? So which one is your first one that you're gonna call? Well, for me, I'm calling the hospital or dialysis for Heather Hart, because something's going on with that kidney. Our numbers are way up. Her mental status has changed. She's not feeling well. She's sleepy. We've got crackles in the lungs. So we definitely have something going on. I would want to see some more information on her. We've got a potassium of 5.8, which is not great. We've got a creatinine. What would you want to know about her creatinine, right? It's 6. So what does that mean? Well, was her creatinine 8 the day before and it's coming down? Or is it starting to climb back up? Was that new kidney really working? So we have to remember, it's really important that we see trends and we understand what's going on with the trend. So with her, I'm really worried something's going on with that kidney, and there's something potentially going on with the rejection issue. Donald Diamond, I think we need to have a hospice consult. The trajectory of ALS, we all know that ALS is a terminal illness, and eventually Donald Diamond is going to die from his ALS. We probably need to get hospice consulted and get them in here and talking to him. His oxygen is 89%. Do we want to keep going up on his trach mask? Eventually he's going to end up on a ventilator. Do we need to have a conversation about what his illness is going to look like? And at what point does he want that line drawn? Stephen Hawking was an ALS patient, and a very rare one where he lived for a really long time with it. Typically our ALS patients live 2 to 5 years. And usually respiratory failure is what gets them. You can see that he's already starting to have some aspiration issues. He's already had aspiration pneumonia 3 times prior. We're probably starting to work on a 4th time while he's in our care. And so we really need to, one, cover our own butts and make sure we're charting that he's refusing to not drink liquids when he's been told that he shouldn't be. But we also need to make sure that he's comfortable and start figuring out where is his priorities. How would you start this conversation with his family? Because trust me, as nurses, you will start this conversation more often than doctors do. Next, maybe see Connor Club, maybe get an ostomy nurse in there. That dusky stoma leaves me really nervous. Was it dusky yesterday, or was it nice and beefy red like we like it? And is that protruding new? I want to get an ostomy nurse in there to help him figure out, because the other thing is remember how important that skin is around that stoma. We do not want breakdown. Think about when you guys each put on an ostomy and when we pulled off all that adhesive and how uncomfortable that was. If you've got breakdown on that skin, it's going to be even worse. So we really want to make sure that we're paying attention to how Connor's doing with the skin around that. And then if it's protruding, if that's normal for him, not a big deal. If that dusky color is an improvement, and maybe he had a much blacker stoma because it was so much dead bowel tissue that was being used, and now it's reperfusing, and so it's slowly getting better. Great. So again, We can't always just make decisions off of snapshot pictures. Sometimes we have to know more to the story. So always be thinking about, what questions do you want? What information do you want more of, so that you can see the trend and see how things are going. And then for Sally Spade, I'd really like to get a speech therapist in with her and figure out if this is a more permanent issue or if this is just caused from her flare-up that's happening. It's really important that we see how she's doing and we get those steroids in. Steroids are really important for people with an MS flare-up, or a lot of times any of the autoimmune flare-ups, because what do steroids do? Steroids, yes, they bring down the inflammation, but they also suppress the immune system. So remember to think about, where on that spectrum is this patient? Which side of the middle are they on? And what do we have to do to get them back into that happy middle space, that homeostasis space, that space that we like to be in? I hope this game was kind of fun for you. I hope it got you to see some different disease processes and help put some of this stuff together. I hope you paused it and took some time to really think through it. And if you need to go through it again, go for it. It's good for you guys to start thinking about information and pulling it all together, because soon you're going to be taking care of these patients, and they are not going to just be cards in front of you, and you're going to have to be making choices of, who do I call and who do I call first?